What is trauma? I'm actually going to go with that word imprint because it's such a perfect segue into this question. Because when we look at trauma, so often we start out with like, what was the event? What happened out there? But the event is over. So now what we're talking about with post-traumatic stress is what's happening inside of you. And so literally the event imprints itself, and sometimes it imprints with image, and sometimes it imprints with certain sensory elements of the sounds that we heard or the felt experience. But more so, the imprint lives inside of the embodied experience and the nervous system. And so basically, what happens is the event occurs and then it gets held within a very high arousal state within the body mind nervous system state. We get basically caught in a certain amount of vigilance or hyperarousal or sensory arousal, and it shapes how we breathe, it shapes the posture, it even shapes our eyes in terms of how we're perceiving the world. And then when we get reactivated into a trauma related state, the nervous system that accompanies that state is what's getting reactivated. And then all of those sensory components related to it are what we tend to feel or re-experience. And I'm sharing kind of one side of the nervous system expression of trauma is basically when we get caught in high arousal states. It's a very classic post-traumatic stress reaction. But when the trauma is ongoing, repeated, unremitting, and there's nothing we can do to stop it, or let's say it's a high trauma event, but we can't escape it and we perceive that it's life-threatening, that there's a different expression that can happen there, which is that we get basically caught in the imprint of conditioned immobilization, or there's nothing I can do. I feel helpless and powerless to change my circumstances. And my nervous system in that place shifts away from that outward vigilance into some quality of collapse, shutdown, withdrawal, urge to isolate, and sometimes nausea, fogginess, dissociation, or even a faint response. So now we're looking at these two expressions of trauma that mirror the two primary states of our nervous system. We're either caught in the sympathetic nervous system or we're caught in this imbalanced expression of the parasympathetic, not the rest and digest version, but the collapsed and shut down version.
Wow, I just got chills.